Hi, I watched video 5 on health insurance coverage. In 2012, according to the U.S. Census Bureau, 48 million people and 6.6 million children were uninsured. The Kaiser Foundation found that the main reason people are uninsured is they do not have access through their jobs and gaps in eligibility for public coverage. The majority of the uninsured are low-income working families. The Affordable Care Act is supposed to help extend coverage to people by extending Medicaid and establishing the health insurance marketplace. Extending the Medicaid coverage will allow 17 million people to have insurance, according to Kaiser. It is important that all people have access to health care. The Institute of Medicine reports that the uninsured actually causes an increase in health costs by ineffective use of health services, the indirect cost of preventable disabilities, and lost productivity among the uninsured, and raises in health insurance premiums for those who are insured to support cost shifting. So the Affordable Care Act will allow more people to be insured, and in doing this will help decrease health care costs. Another way that the Affordable Care Act will help extend coverage is by allowing young adults to stay on their parents' plans until they're 26, and the health savings accounts. The health savings accounts, I believe, are very useful in that people can set aside money, so they have money to pay their hospital bills and doctor's bills when needed. Topics that I learned this semester. First is about access to health care. I didn't realize how big of a problem access to care was, especially to primary care, until going through this course. Learned that physicians don't want to go into primary care and would rather go into specialty because they get paid more and they have high school loans to pay off. As nurse practitioners, we can go into the primary care role, especially in rural areas, and provide this care. The second thing I learned was about the legislation and regulations. I didn't know really the process that things took to become bills or how that worked. And it's important to know as a nurse practitioner because we need to know these regulations and be aware of bills because they may change how we practice. The third thing that I learned is about the Affordable Care Act. I knew it was passed. I knew kind of essentially what it was, but I didn't know everything that entailed and how it was going to improve access to care and help lower costs. And all these things are important to know as a nurse practitioner and how it's going to affect the healthcare. Thank you.